Hi, Dr. Mallory Stuparich, endometriosis surgeon in Orange County in Southern California. Not infrequently do I get patients asking me about alternative therapies for endometriosis related pain, and I came across this article as I was reviewing all the things that had been published in the last week on endometriosis, and I wanted to take a moment to go over this article today. So, this is entitled The Efficacy and Safety of Traditional Chinese Medicine for Endometriosis Related Pain, a Meta Analysis. And what these authors did was they conducted a search on the randomized controlled trials of using traditional Chinese medicine in the treatment of endometriosis related pain, and essentially pared it down to, as you can see, 11 studies that they took an in-depth look at. Now, the studies were a little bit heterogeneous, meaning that each of the studies wasn't exactly conducted with the same protocols or in the exact same manner when compared to the other studies, but they had a couple of endpoints that they were looking at, one of them being dysmenorrhea or painful periods. And so they basically plotted the effect of traditional Chinese medicine on the visual analog score for dysmenorrhea, and they did notice a statistically significant reduction when traditional Chinese medicine was used. Similarly, they found a reduction in dyspareunia or painful intercourse. They also looked at things from another angle and actually looked at laboratory biomarkers. So there was a reduction in interleukin 6, which is an inflammatory marker, and there was also a reduction in TNF alpha. Now, one thing that did not reach statistical significance was a reduction in pelvic pain score. Now, any scientific study should also review limitations of the study, and the authors note that there was inconsistent methodological quality of the included studies, whereas some may not have had adequate randomization or may not have had appropriate blinding, which can introduce bias. Secondly, the studies did not employ the same traditional Chinese medicine regimens, and so that makes them more heterogeneous or different from each other. And lastly, there was no subgroup analysis performed on each of the individual regimens that were included. So it makes it more difficult to generalize this to more people because there were differences in the individual methods that were used. But the study does conclude that traditional Chinese medicine can alleviate endometriosis associated dysmenorrhea and dyspareunia. And again, that is pain during menstrual periods as well as pain during intercourse. And there is a downregulation of inflammatory factors. So this certainly could be a consideration when constructing an individualized treatment plan for a patient with endometriosis. Let me know if you like this. This could potentially be a series that I do, so let me know your thoughts in the comments.